Hey everyone, Angie Harness here with Keller Williams, Senior Real Estate Specialist. Today, I have on the wonderful Lisa Smith with Health Group Advisors. And if you stay tuned, you'll get to hear my story about Larry, Libby, and the septic tank, but you have to watch. Otherwise, you're not going to hear it. Anyway, a little bit about Lisa. Lisa, she and her husband, Adam Smith, own the company, and they specialize in helping people with Medicare, seniors, obviously. A perfect time to reach out to them is like now because open enrollment is coming up. We'll talk more about that later. Little fun fact about Lisa is when she was in college, she owned a Python, which is hilarious. And she has a very good stretching, she's laughing, a good stretching routine. She can still do a headstand at age 42 and do the splits. Pretty cool. And they have two beautiful children. They have a boy age 9 and a little girl age 6. So welcome, Lisa. Just embarrassed her.
Oh my goodness. Okay.
That's a great way to start the show. So Lisa, we were chatting a little bit ago. One of the things that you shared with me, just tell a little bit about the difference between Health Group Advisors and other Medicare insurance
Okay. So we are brokers. So a lot of people, they just work for one specific carrier. So we're able to work with all of the Medicare insurance carriers. So we can actually find a plan that best suits you and your needs. So we don't have to pick just from one company. We have a lot of options to make sure that we get the best cost or the lowest cost or possibly no cost for their Medicare supplement or their Medicare insurance.
That's amazing. And one of the things when we were talking a little while ago that is impressive to me is that there's a lot of certifications you have to go through, a lot of work and effort you have to put in to be certified with all of the carriers. That just to me shows your dedication to the senior community. And I asked you earlier, and I'd love for you just to tell everybody why this path and why working with seniors.
So I've always loved seniors. They have a special place in my heart. And when I've worked with them for 15, 17 years. And whenever I do, I get lost in their stories and I get lost in all of their experiences. And I could just I could sit for hours and hours and hours and listen to their stories and their experiences. And it just melts my heart. Some of it just brightens. It could brighten your day and also just makes you want to help them if they need help too, because they're the generation that they've given so much. Most of them, it feels like they have. And so now it feels like that we should give back to them. It just feels like the right thing to do. So between that and the stories, how could you not love working with seniors?
Yeah, I 100% agree. It's, they're kind of some of my favorites. For the exact same reasons you just outlined. They deserve it. And unfortunately, they're also a population that often gets taken advantage of, which is really, really sad. So it's so wonderful that there are people such as yourself and your husband who are out there actually looking out for them. I also want to talk about the consultation, because I think a lot of times they avoid picking up the phone and calling somebody because they think they're going to be sold. And you guys do things a little bit differently. So can you just share a little bit about that?
Yes, of course. So there's a no cost consultation. And whenever we meet with people, we realize that they're most of the time they don't have the knowledge that we do with Medicare insurance. They probably didn't read the Medicare book from front to back like we have. So whenever we meet with them, it doesn't matter what plan they're in. We want to educate them to make sure that they're in the right plan. And if they're in the right plan already, then that's okay. Hopefully we've heard some stories and made friends, and hopefully gave them a lot more information, just because educating them is something that people kind of skim over sometimes. So if we can bring them some information that they don't know and help them make a decision, then that is really our goal, is that they're in the right plan. And whether it be the plan that they're in or a plan that we offer, then either one is fine with us. We just want to make sure that we're there to help and answer those questions, because it can get so tricky and trying to navigate through the whole process. Try to make that easier.
Absolutely. Well, and that just shows where your heart is. I love that your goal is to make sure that they are in the right plan for themselves. And if they don't need you, they don't need you, and you're good with that. And I think that's really key. So no one needs to be concerned that you're going to be pushed into something that you don't want to be in or isn't good for you, because that's not what you guys are about.
Exactly.
Yeah,
exactly. And that happens. We've met with people, or I've met with people that their plan is perfect for them, but they really just didn't know. And that's where I want people to know that it's important that you can call, you can give me a call, and we can just go over some of the options, or just kind of go over the plan that you have if you have any questions. But we're not going to make any changes unless it's really in their best interest. We're certified with all the carriers. So like you were saying, we go through that process to make sure that we do know the extra benefits. There's extra benefits such as you can get a Fitbit. There's some of the companies are offering $250 credits. I mean, there's all these different extras, is what I call them, with different plans that some seniors or some folks don't know anything about. So we can educate them on that as well. And it's their right to have those things. I mean, they worked for at least 10 years of the workplace. So it's important that they get what they deserve.
Yeah, I 100% agree. Really, what I hear you saying is you're selling peace. Well, you're not selling it. You're giving away peace of mind is really what you're doing at the end of the day.
Yes, that's what we strive to. Yes, absolutely.
Because we want to have healthy lives, and part of that is, what kind of care we get, and making sure that that's funded. If someone does come to you and they do need to do a different plan, what financial obligation do they have to you at that point?
Zero. We do not take any money. There's no money to be exchanged. A lot of the plans are zero premium. So sometimes we can actually help them find a zero premium plan that covers their prescriptions, their doctor's visits, their dentist, there's all these different things that come along with health insurance that we can help them with. And so many times we get the calls and they had no idea that they could get those benefits. So I'm thrilled whenever I can see people save money. I mean, we helped somebody that saved $1,300 a couple weeks ago, $1,300 in a year, because she just didn't know that she would qualify for extra help. So depending on your income, then there are people that can qualify for extra help and get a lot of free things that they deserve and that they've earned. So that's really exciting to share with people too, because it can really change. Especially when they're on a fixed income, so it can really change their life if you could have an extra, $1,300 a year raise, and you're not getting anything less. You're getting more than what you were before. So that makes my heart happy.
That is amazing, Lisa. Like, you totally made me misty-eyed when you were talking, because I could just see like your face just lit up like a Christmas tree when you're talking about helping these folks who have been really underserved because they just don't know what they don't know. And when we were talking earlier, we were talking about, sometimes people, maybe they're on Medicaid and maybe they're in a situation that they don't know that there's actually benefits out there that they could be receiving that would change their life. And please, if you're watching this, share this information with people, share it with people who, share it with your seniors in your life, share it with people who might need some help, because even whether they call Lisa and Adam, which I think they should, they do need to know that there might be some help out there that they could be getting that would change their life, which I think is amazing.
Yes, absolutely. It's their insurance. It's their health insurance. So they should know all the ins and outs to it. I mean, all the details, they might not want all the details, but that I can handle the details. But we just want to make sure that they're in the most cost-effective plan for their needs. So that's really important. So we dig down and get to the nitty-gritty to make sure that they have the best coverage.
That's amazing. Is there anything else that we've missed that people should know?
You know, I think don't hesitate to call, and just to I'm not going to ask your credit card number or anything, or your social security number. I'm not going to ask any of those questions, but I just don't want people to miss out. So if you have any questions at all, then feel free to call and know that it could just be just a few minutes on the phone, or I can meet you in person. Either way is completely fine with me, because if you have stories to share, I would love to hear them. And I would love to give any education and anything that would benefit them and their livelihood.
That's awesome. That's awesome. And what are the last four numbers? CARE?
Yes.
That's 314949. And then what are the last four?
It's 2273. CARE, CARE, or 2273.
Yeah, I always have to. I can't think of that.
I know.
Anyway.
No, I totally understand.
Yeah, my nickname is Sheldon, but I'm not actually a Sheldon. So there you go.
Nice.
So I promised that I would tell the Larry and Libby story. So, and the septic tank. So, and you inspired me to tell us because you were talking about seniors and their stories. And Larry was in World War II. I believe World War II. I might have the war wrong. No, I don't think so, because I wasn't old enough. Anyway, he was a pilot. And I don't think he was Air Force. I don't remember. It's been a few years ago. But anyway, I was selling their house. They lived on this beautiful property out in Warrenton. They were on like 4 or 5 acres. There was a stocked lake that people who lived around it, got to use. And anyway, anytime we needed to do anything, I would go to their house to physically do documents. And they had a deal that fell apart. And one of the issues that came up on the inspections was a septic tank needed a pump. So I'm at their kitchen table, and Larry and Libby are both, they're in their like late 70s, early 80s. Okay. They're not young people, and they're both cracking up telling me this story. And it's wintertime. There's snow on the ground at this time. And Libby starts talking about how she couldn't find Larry. One day she was looking around for him. He wasn't in the house. She went to the garage. He wasn't there. So she steps outside and she hears, "Help, help." And they're both laughing, telling the story. He's in the septic tank. That old man, he went to Lowe's. He didn't go call somebody to fix this, because there's people who will do that, right? He goes and buys a pump, and he's in the winter installing it himself. And he happened to slip.
Yes.
Now, thank God, he's lucky. He falls in, and his pants, thank God, he managed to like grab onto something, and his pants got hooked on something, and he pantsed himself. No pants. He can't get out. Like, Larry, what are you thinking? Of course, Libby had to call 911, and they got him out. He wouldn't go to the hospital, get checked out. He was a little banged up. This is a week later when they're telling me this story. And I'm like, they're just cracking up. I'm like,
oh my gosh.
But that's how, just, he was a military guy. He's going to do it himself. He was still tough and still vibrant, and he wasn't going to pay somebody to install that dang pump. He was going to do it.
Oh, that is funny.
Thank God he didn't fall all the way in, and he didn't, hurt himself, but, other than bumps and bruises. But yeah, so that's the story of Larry and Libby in the septic tank. And this is why we love our seniors, because they're fun and sassy, and and that not only do they have the best stories, but they're making new ones all the time.
Yes. Yes.
Yeah. All right. Well, that's all I've got. This has been the amazing Lisa Smith with Health Group Advisors. Definitely give them a call, share their information. Our seniors deserve to work with people who actually truly care about them and have their best interests at heart. So please call them. And I'm Angie Harness with Keller Williams. I'm also a senior real estate specialist. If you know of any seniors who are needing to transition, I would love to have a conversation with them and offer them a consultation as well. And we wish you all a blessed day.
Thank you so much.
You're so welcome.